CataractCoach.com, academic versus private practice. Which is better for you? And can you even do a hybrid model? So Cataract Coach coming to you today from Palm Beach Gardens, Florida, where I'm visiting Dr. David Goldman at Goldman Eye. And there's a neat perspective that we can bring you today because Dr. Goldman has both the academic perspective as well as the private practice. He was full-time faculty at the Bascom Palmer Eye Institute in Miami and their satellite offices. And then he's now in private practice here at this facility. And so tell me, what do you think are the major differences between academics versus your private practice? What's your input from that?
Yeah, there's actually a lot of similarities and a lot of differences between academics and private practice. And it really depends on what you're looking for. So initially, I was more interested in academics because I wanted to do a lot of clinical research. And I wanted to be kind of first in line at developing new devices, trying out new devices from companies. Over time, I learned that a lot of that stuff is actually easier to come by in private practice. A lot of clinical trials, you have to go through an IRB, but if you're in a university setting, you sometimes have to use their IRB, and a lot of the industry doesn't want to do that necessarily. Also, just in terms of getting new equipment into your surgery center, it's a lot easier typically in a private outpatient ASC than in a hospital setting. There's just a lot less red tape to get through.
I think you're right. I can give much better patient care in my private practice environment than I can at any academic facility.
Yeah, I remember having many meetings about buying equipment, new phaco device, new laser for the surgery center in academics. Whereas in private practice now, if we want something, we just go ahead and we buy it, and that's it. As long as everyone agrees and there's not a lot of arguing, okay, this is what Goldman wants, Goldman gets it. Or if they say, we're not going to get it, the Zepto laser, I wanted it, the surgery center said we already have a femtosecond laser, I said, okay, no problem, I'll buy it.
But get it yourself.
And get it yourself, and you have that flexibility and that ability when you're on your own in private practice.
I think for sure, if you're a young doctor looking to decide, do I do academics or do I private practice, you can do both. You can do either, or even better, do a hybrid, and you can always evolve it in the future.
And I would say if you're not sure what you want to do, it's easier to start in academics and then transition to private practice than the other way around, although it has obviously been done many a time. But it's certainly easier to go on that path if you're not sure. And joining a group practice versus starting your own practice, again, lots of pros and cons. It really depends on your situation and where you want to be.
The other thing to really keep in mind is keep good friends very close. David and I know each other at least 15 years, maybe longer.
Absolutely.
And though I don't get to visit him too often, or he doesn't visit me too often, every academy meeting or big ASCRS or other meeting where we meet together, and we often email or text back and forth, exchange ideas. I want someone brilliant to bounce something off of. I come to him.
Oh, absolutely the same way. Same way here. I know I've texted you and messaged you before about patients, and it's the kind of things where you can't wait till the next meeting, and maybe a lot of people don't have experience. So to have a network of colleagues that are talented and have that experience and can guide you is just great, especially if you're in a field like ophthalmology and you really love what you do and you're like us and you're just trying to get the absolute best outcomes for your patients every single time. To have those kinds of lifelines is just fantastic.
Yeah, so don't worry, private practice, you're not a lone wolf ever. You're your own boss, which is a great thing, but you have a network of colleagues that are always there for you. And then finally, the last thing I want to bring up too is, in private practice, we're able to do things that sometimes you aren't able to do in an academic center. So I can learn newer techniques and bring them to the facility before they're widely available. And then ultimately, that benefits the patients. And finally, the flip side of that though, the tough part is in an academic institution, all the patients are fed to you. You don't have to do anything. In private practice, you've got to go out and drive the patients into your practice. What are your pros there? Because you've done an amazing job. What a gorgeous facility you have. Maybe I'll do a little video walkthrough and show you afterwards for my viewers. But how do you drive patients in the door?
Yeah, so there are multiple ways, but first and foremost is patient care. If you do good surgery, good clinic, your patients have great outcomes, they're going to tell their friends, they're going to convince their friends to come see you. So in addition to treating people well on a bedside manner, we also get good outcomes, and we also make sure they don't wait forever. A lot of practices, and that was a big problem with academics, is patients would wait for hours and hours and get really upset about the waits, 2, 3, 4 hours sometimes. Here we try to keep every patient visit under an hour, and often less than that if we can. We really want the patients minimizing their downtime. If they're here getting tested, having their eyes dilated, that's different, but we don't want them just sitting in a lobby. In addition to that, we work with all doctors, so not just internal medicine doctors, but when the patient comes in with diabetes and we're evaluating the retina, we also communicate with the endocrinologist. If it's a lupus patient that's getting plaque retinal screening, we make sure to communicate with the rheumatologist. So it's not just ophthalmologists or optometrists that are referring patients to us, but it's the cardiologist that remembers what good care we took care of their patient, the rheumatologist, the endocrinologist, the primary care doctor, and that also generates a lot more patients into the practice.
Such great advice. Ultimately, we have the same philosophy. For all our patients, we give you the very best. We're going to give you the exact same treatment that we would want on our own eyes. And that leads to incredible word of mouth, and patients know. I want to say thank you. What an incredible time visiting your practice. Such an amazing place. I'm going to shoot an extra video to show my viewers around your place. And hopefully we'll have you back on CataractCoach soon.
Absolutely appreciate it, Uday.
Thanks. Bye, guys. Let's take a tour of his beautiful clinic. So you have a minor procedure room here with a microscope and some other devices. The clinic is obviously beautiful and modern. Multiple exam rooms here, all fitted identically. The slit lamps, 4 opters, and I like the patient's family area as well, so the patient can be joined by family members. Very nicely done. Let's bypass a few of these rooms for patient privacy. Some offices here, and you can see a general workstation for patients and their staff members. More exam rooms. Again, we'll bypass these. All the exam rooms are very consistent, very clean. They all look good. Let's cut that patient out of the view. Here we go. Coming down this hallway, another exam room, and of course, coming up to the procedure rooms, but also the diagnostic rooms, all the diagnostic equipment that you need there to measure eye, the biometers, OCT, anything you need, visual fields. And then here, he has his laser suite. Very nicely done. 2 lasers there. One's a femtosecond laser to make a LASIK flap, and the other is an excimer laser. That's a beautiful setup. And it's really nice to have that in the office. If you're doing cataract surgery, you need to enhance a patient. The ability to do LASIK on them or PRK is very helpful. Plus, you can develop the refractive surgery part of your practice and then checking out at the front desk. Thanks for watching.